Hello, and welcome to Kansans Responding to Community Mental Health, a guide for local health departments. We're excited for this opportunity to take you on a journey to how we got to where we are today. Before we get started, let's meet our presentation team. I'm Julianne Walker, and I am a program specialist here with Wichita State University Community Engagement Institute, Center for Public Health Initiatives. I joined this team about a year and a half ago and came to this work mostly from a career in social services and working in nonprofit organizations. When I joined the team, I was able to jump in on the work that was being done on this behavioral health project we're going to be talking with you a little bit about today. And I was especially thrilled just after hearing the story of how the project began and kind of where its roots are here in Kansas in one of our counties. And so you'll hear a little bit more from Tom in just a little bit about that story. But I'm going to go ahead and let Aaron and Tom introduce themselves, and then we'll get started.
My name's Aaron Davis. I'm with the Center for Public Health Initiatives at the Community Engagement Institute at Wichita State University. And so I am interviewing Tom Langer, who has helped us tremendously with this project. So, real quick, I've been in public health since 2006, kind of bounced around the system here in Kansas and have been at Wichita State University for 9 years now. So, Tom, you want to go ahead and introduce yourself really quick?
Sure. I'm Tom Langer. I am the administrator of the City Cali County Health Department in Cali County, Kansas, and I'm also the county's public health officer. I've been in Cali County for almost 8 years now. That's hard to believe. And before that, I had worked for the Kansas Department of Health and Environment for about 10 years. So I came from Topeka to Cali, and I went from the state level to service delivery level, and have enjoyed it ever since. And uh, I've just embraced this because you know public health, it truly is a calling. You've got to either believe in it or not. And over the last few years, I believe, and I hope we can restore it all to its luster and glory again, even after the pandemic. So
All right, well, thanks for that, Tom. And yeah,
you
let's
bet.
go ahead and dive in.
Local health departments are crucial partners for communities working to improve behavioral health. In Kansas, partners created a framework and a guidance document to help local health departments engage with behavioral and mental health issues. Regardless of their size, rurality, and starting infrastructure. Participants will leave this session today learning about some of our lessons learned and with recommendations for others considering a similar approach. Come with us today to learn the story and follow the journey. Let's listen in as Aaron and Tom take a step back in time to what prompted work on this project.
Thanks for joining us on this adventure we have going on.
Glad to be here.
Well, hey, I kind of want to jump right into it as we start talking about kind of the
Mhm.
efforts that we've had and the document that we're presenting on. I just want to really jump into what got all of this started. And I don't know if you remember the conversations we had back in June 2018. We were
Mhm.
at the kind of a meeting for local health department directors,
Mhm.
and you had some stuff that was really kind of weighing on you at that point,
Yeah,
some events in your community. So I just want to know if you could just start us off, help set the scene for this whole
sure.
adventure, and kind of tell us what was going on back then.
The spring of that year, of course, this was pre-pandemic and everything else. We were going along, and we had a rash of suicides that critically affected the teen population, and by that I mean the middle school, high school age group. Just really rocked us. We had, within a period of probably about 45 days, four people end their lives.
Mhm.
And each one was tragic, and each one was not foreseen, it seemed like. And we were in a conundrum about what's bringing this on, what's happening, what are we not seeing. And so I remember distinctly asking some of the other, some of my peers at that meeting, are any of you having this same type of, occurrence happening in your counties? And if so, what are you doing, or where do we begin? And there was just a feeling of, total frustration, because this was not something that we as health departments were always involved in. But when it hit that kind of critical mass, it certainly ended up on my desk with a lot of questions from people. And so I didn't have the answers, and I asked, and everybody kind of looked at me with the same thing. And then you approached me and we spoke about it, and I gave you the details. And that, that was, gosh, I can't believe it. It's 4 or 5 almost years ago now that's happened. But that's how it got started for us, and that's where we were at that point in time.
Yeah. Well, and with our work at our center, just trying to help support health departments, I mean, I think I kind of immediately jumped in knowing that we've got to do something. You weren't the only one having these types of issues, but I think you were probably the most vocal about it at that point.
Yeah, it was kind of a low time. It was,
Yeah.
you don't expect to see that in a county our size, and so, again, it was like, what do we do? This was not what I was trained for, and we had to do something.
Which I think probably leads into my next kind of follow-up question of, without getting into all the details, you're from a smaller community there, about 35,000. So it's actually one of the larger counties in the state. But why was this coming to your desk? Why did you feel like you had to be one of the main players getting involved?
You know, Aaron, I think one of the low points of it was when I spoke to one of the families, and one of the parents looked at me and says, "You've got to do something." Now, when you're faced with that kind of blunt reality, you can't stand back and say, "Oh no, I'm in public health. The mental health component isn't my area of expertise," which it wasn't. By no means would I stand in front of somebody and say I understand the intricacies, of this kind of despair. But um, that opened me up to really looking at that wholeness of individual health, and what the role public health plays in it. And I already knew that not just in our county, but everywhere, it seems like there was a lack of available services
Mhm.
for this type of situation, where you had young adults or teens or anybody really having problems that could get adequate help. We really weren't paying that close of attention to it. We were responding to the crisis. We were trying to be understanding and clean up the mess, and we were just wringing our hands saying, "Oh, poor us. What do we do?" And it comes a point in time where you have to accept ownership of something and say, mental health is part of public health. As a matter of fact, I don't believe that there's a separation in that now.
Mm.
That has happened over the last few years, and so we had to take a look at it holistically.
The openness that Tom had at that time to share the fears and discouragement he was feeling and his willingness to ask for help was something that Aaron just could not ignore. He immediately went back and engaged the team at WSU, Wichita State University, and took Tom's story and his desire to move the needle and began to turn it into action. The team did some research on what was currently happening within local health departments around behavioral and mental health. We also looked at how other entities and organizations were looking at behavioral health within their current structures. This research led us to a framework that was developed out of New York State for advancing the integration of behavioral health into primary care. This particular framework was developed by Dr. Henry Chung and Dr. Harold Pincus. Their framework included key guidance and underlying steps to help advanced integration into practices, regardless of organization size or resource constraints. It also provided a starting point for us to take a look at how some of this information could be translated into something that would fit the foundational landscape of public health and health departments across Kansas. Knowing that local health departments in Kansas are not typically structured to provide primary care services, we needed to explore other ideas around other types of integration of behavioral and mental health, and or creating opportunities for community coordination of referrals and also resources. We worked from the following beliefs about Kansas health departments. We know that local health departments carry credibility in their communities. We also know that people understand that health departments can help and manage in crisis situations. Local health departments possess many strengths and are often those leaders of innovative work and partnerships within their communities and the counties they serve. So it makes good sense that local health departments have some involvement in behavioral health, mental health, and overall community well-being. We realize that this does not have to be a full integration of behavioral health or mental health services within the scope of the local health department. It simply means finding ways to connect to the issue and support the needs of the community.
The frustration, the desperation, I think is what it was more than anything was, what do we do? How do we begin? How do I go back and tell people we're going to look at this and do it when I had no idea where to start?
Yeah, well, let's talk about that a little bit because, when we had our conversation, I didn't know where to start either. And I think, it was probably 12 months of conversations, facilitated meetings, research. And I mean, I don't think we made a whole lot of progress in figuring out, what is something that can not just help you, but other health departments as well figure out this role. And then we kind of stumbled upon this framework. We borrowed some of the concepts of, instead of thinking about behavioral health, mental health integration in a health department as this big encompassing element, like, it's really bite-sized. There's actually just certain areas you can kind of focus in on. And so we did a lot more research onto what those elements looked like and how to make progress in them. And then we started, convening our design team. So, there's two elements. There's some of the research that we were doing and trying to dive deeper with you and some other health department directors, as well as what you were doing kind of on your own, right? And kind of some of the things that you've been doing there.
Through the process of convening a design team made up of Wichita State University Community Engagement Institute staff, Kansas Department for Health and Environment partners, and also local health department directors, and offering presentations at state convenings for feedback and input, a guidance document, kind of a toolkit of sorts, was developed. This guide, being a toolkit of sorts, is designed to provide information and other tools and ideas that utilize local public health expertise and also programs to strengthen behavioral and mental health efforts in communities. It includes 4 main pillars, or what we also call domains, to address the primary areas in which behavioral and mental health might be most effectively addressed by local health departments. These areas include workforce development, organizational structure, clinical workflow, and community efforts. Within each of these domains, information about best practices provided, along with guidance for varying levels of engagement and activities, really based on where the local health department is in its current practice. The purpose of the document is to provide guidance for LHDs to begin to expand or test applications of public health approaches to community behavioral and mental health needs, understanding that not all health departments in Kansas look the same. The tools and recommendations are tiered such that each level of integration may be considered in the context of each community's needs and resources or lack of resources. Additionally, the tiered approaches are not an all or nothing approach. They're offered for consideration in what we look at as preliminary, intermediate, and advanced activity levels. Using this QR code that you see here on the screen, or going to the website listed here, the full guide is available, and it's on our Kansas Public Health Collaborative website for you to use, access, share. tweak whatever might work best for you, but we want this to be a collaborative document that anyone can pick up and use and kind of find a place to start. So finding and deciding where to start is really very individual for organizations to decide. So let's listen into Tom to see where he got started.
I don't know if you just want to give us kind of a highlight of
Yeah.
some of the things you've been doing.
Well, you make a you know perfect point about the fact that we had to do something. The status quo was never going to be good
Mhm.
enough at this point. Couldn't give it just plain lip service, and the elephant in that room was enormous. And we always talk about those metaphors. You can't eat the elephant, so you take it one bite at a time. And so for us, it was just trying to figure out, well, what can we learn? What can we do? How can we as individuals change behavior, internally in the domain that I control, which is the health department. So, that's 20 staff members, 2 locations. We interact with, you know, we have tens of thousands of appointments every year. And so how do we change little things to start making a difference? And not only that, but how do we become better aware of noticing the signs? It's just like if we had somebody come in and they were running a fever and they had a sore throat, we'd say, well, these are symptoms of an
Mhm.
illness. How could we learn, what to look for um, in the work that we did to where we might be able to um, employ some, you know, proven practices or tools or whatever to give us a better understanding of where an individual might be on a specific day and time. And it was scary to think of. We have licensed nurses and practitioners and people that are there. And when we sat down and we talked about it in a group, I told them, look, guys, I'm not trying to make you psychologists or, anything like that. I just want us to be more aware. And and we employed best practices that we could find. Sometimes a little diagnostic tool that would just be little questions that get answered when they come in, when a person comes in for an appointment, um, that we knew might help us better determine. And then we brought in trainers to the community for us to send staff to the mental health awareness courses, which really helped. I mean, it allowed us to think about it in a different way, and to start breaking down the stigmas perhaps associated with mental stress and mental health issues and crises. And those things really worked out, and that's where it all began. It was the one thing. It was just like, guys, if we can come in every day, even when we're not feeling so great, and put a smile on our face and say nice things to people, the impact that might have on their day could be quite profound. And so we began saying, let's let's do what we can control. Let's do what I can do as a person, what you can do as a person. And it started with those interactions from person to person, a smile and a thanks, we're glad you're here, as opposed to, oh, what do you want, kind of a thing. So there was that difference in just mindset and posture. And you might think, oh, that's really a silly thing, but I'm telling you, it's not. It works, and we've seen the proof in that. So that's where we started.
Tom has started some of the work in his area and within his department in several of these domains that are offered within the guidance document that you see here on the slide. So let's dive a little bit deeper into what each of these domains are. We'll start off with workforce development. Within workforce development, we're thinking about things that include areas that will enrich the work environment for staff through education and skills training in best practices, and also the inclusion of trauma-informed systems of care training and practices, and then also the supervision piece that goes with that. Also in this domain is really kind of taking a look at your staff makeup and hiring practices and what kind of language is used when you're looking at the hiring process, and also job descriptions. Are they trauma informed? Are they inclusive of making sure that staff has the training that they need to really be able to come in and perform at their best in a supportive environment? So the next domain is organizational structure. This one involves local health departments being able to identify existing strengths while also developing additional ways to explore components of their own organizational structure that support behavioral and mental health through internal and also external activities. Systemically supported trauma-informed policies is a part of this, quality improvement measures, and also pathways for sustainable financing to increase a local health department's ability to address behavioral and mental health community concerns. So the third domain that we see here is another key focus within the guidance document. This one aims to ensure teams will know how to respond when a client actually walks through the door. So it's really kind of creating that workflow process that all staff know, understand, and value. A clinical workflow can act as a guide to not only provide an equitable process for clients, but also allows staff a guided process to follow with each client and also their specific needs. It includes exploring the addition of things like screening tools and creating seamless communication across the organization, and also enhancing the referral process. So lastly, let's take a look at community efforts that's listed here. Here, public health professionals can really start by mapping the assets that are currently in their community that may or may not be well known, building effective partnerships with those other organizations in their communities and counties, up to and including formal MOUs, and also creating the infrastructure to maintain those relationships. Additionally, community efforts include defining relevant data and also creating methods for sharing that data among other collaborating organizations, and what that data sharing process would and could look like. So let's eavesdrop again on Aaron and Tom to listen to them talk a little bit more about the importance of finding opportunities to bring about change, and also the ripple effect that this can have.
So you have seen a shift in the attitudes of your staff over the last 5 years?
Oh, absolutely. They understand now too. And, we talk about these things because that's the one thing too. Let's talk about it. Instead of talking about it after the tragedy, let's
Mm.
talk about it before the tragedy. We've just come through the month of May. And, May was always that month. It was so many things going on, school year coming to an end, proms, graduations, Mother's Day, all this stuff that's happening in there, and, end of the school term. And it was hard for me to understand, how can this time be so hopeless for somebody? How could it be that way? And then we began to understand a little bit deeper, what was going on, that the end of that structure meant somebody was maybe having to go back into a hopeless situation again, and they didn't want to face it, or whatever personal circumstances or tragedies they may face within their families. And there were some that were quite intense, we found out. Um, but we worked that way. And the other thing we did is we really did some effort to reach out to our educators in the county and all the different school districts to say, look, this is a big thing now. Just like we want all of our kids to have all of their vaccinations so that they can stay physically healthy, we have to start looking at them from a holistic perspective, and think about what their life is like, and what kind of pressures might they be bringing with them on a day-to-day basis into schools and classrooms. And one superintendent summed it up for me, I think, the best. He says, "Yeah, Tom," he says, "a kid's not going to think very, very well if he doesn't have a house that he's living in, and he's not going to be very optimistic if, you know, it's the start of baseball season and he can't play because there's no fees, fee involved, or can't get a pair of shoes, or some of those things that some of us would take as being really minor, but really, really affected a child, an adolescent in a profound manner."
Mm.
And so, again, we started thinking forward and trying to say, okay, what can we do to make sure that those pressures aren't there, and if they do exist, that we might be able to see them in advance and make a little adjustment somewhere. Somebody being kind, buying a kid a pair of cleats, you know if that's gonna save a life, I'll buy them all day long. Those are the things that really, they don't sound like much, but as an
Mhm.
intervention for one person, it can be exceptionally profound and exceptionally impactful.
Uh, So from an organizational standpoint, the frame that we've been using is for your health department, thinking about the workforce needs and opportunities, kind of your organizational structure and how to shift some things, clinical workflow that you can kind of work some of these pieces in, and also community efforts.
Mhm.
Um, and one of my favorite quotes is something to the effect of, when taking your first steps, direction is more important than distance. As long as you're
Yeah,
heading in the right direction, at least you're going to be making the progress you want to make, even if it takes a while.
right.
So I'm curious on, now that you've been a little more involved in the development of this tool and kind of
Mhm.
how we're breaking it apart and wanting to engage more departments in it. What's that been like, and do you have any kind of overall thoughts about this strategy?
Yeah, I think, one of the major components that made it so overwhelming for me at the very beginning was I saw that, like, we this was an enormous issue, and we had no idea how to start. Nothing, and when we decided, okay, we're going to do these things, it was it was really breaking it down to the ridiculous, because I'm in one of those positions, Aaron, where if we have a programmatic change that we're trying to make, you know, we always sit there as administrators and we look at it and say, what's this going to cost? Can we afford it?
Hmm.
Where's the money going to come from? You know what? I didn't care about that at all. It was like, this matters not. Um, we'll find it somehow. We will beg, we will borrow, we would do whatever we had to do to make it start happening. But we were realistic about it. We weren't going to be able to have uh, here's a single pill, take it, everything is beautiful again. No, this was going to be an absolute long haul, and there's work involved with it. But I got to tell you, the work was not as backbreaking as I thought. The rewards of it were fabulous, because I was able to see it not just in the health department patients or the clientele, but I could see it in my staff when they started changing things and they bought into this, which they have. You know, it it made a profound difference. Just the office was a better place to be. They didn't bicker about little things as often as it seemed they had in the past. And when they work together all the time, those things happen. I challenge any health department or
Hmm.
any office to tell me that those things don't come up. But there was more of a concerted effort by everybody to make people realize that, yeah, when you come to see us at the health department, we really are working for your, to better your health, and not just physically, you know, every component about that. I don't really want to go deep into the weeds, Aaron, but we've extended this into our maternal and child health program.
Hmm.
We've put this into our family planning program. We've put this into every single program that we've got. And for those of you that are using electronic health records, it's just basically adding a few things to your notes so that during the course of your appointments, you're maybe asking a few extra questions, and you do it conversationally. But if you do those right and you're using them in the right framework, they're going to tell you things. We've seen, um, a kind of a really unique response in family planning of all places. Imagine a person comes in and they don't know if they are, and they test and they find out they're pregnant. Okay. The range of emotion that they can show on that test result is immense. A lot of them, and the vast majority of them, are happy. They're thrilled. Some of them are not too happy at all. And then you have some that are absolutely mortified by this. So, understanding again what our clients are going through, or those people are, and being able to adapt what we have learned to then ask the proper question. How are you feeling? Are you okay? Do you need some additional resources? How can we help you? So that they don't walk out of there feeling alone or hopeless. That's it. And we do it anyway. Those programs are funded for us, and it's just adding this additional component because mental health is public health, and I guess that's going to be the motto on my business card. And I'm certainly not a psychologist. I'm a public administrator, for goodness sake, and if I can do it, anybody can.
This is an example of the community efforts domain that is within the guidance document, and it illustrates here the design of the tiered approaches that I spoke about a little bit earlier. A health department can really start with any domain, whether that be workforce development or clinical workflow, and at any level of activity that they see as a viable starting point based on their current structure, practices, capacity, size, and in Kansas, also their level of rurality also makes a difference. The tools in this guidance document can really help expand horizons around what can be offered within behavioral health and mental health in order to impact community well-being.
Yeah, I think one of our hopes is that, this isn't a toolkit you're gonna pull it up and get all the answers, right? But it's a
Right.
conversation starter amongst partners, amongst other health departments, so you can start to figure out what are others doing, where are they kind of expanding their horizons and trying new things so we can learn from one another.
From a truly public health perspective, I have struggled for years and years and years to prove that what we do
Hmm.
works. And you cannot do that sometimes when disease is absent. People don't believe you that it's the efforts that you put in that help create that. But when we can go from where we were,
Hmm.
a very short time ago, to coming in to having zero suicides, and even fewer, perhaps, getting the attempts down. Um, that's powerful stuff.
Yeah.
That is something that I'll walk away at the end of my career and say, you know what, we made a difference. What we did made a difference, and saved somebody's life. That's you don't have to pay me to do that. That's just what we do.
Something that we hear with valid concern is some of the barriers and or hesitations that health departments see in front of them around adding in behavioral and mental health activities. This can often hinder their efforts in really finding that place to start. Some of the common barriers expressed, first and foremost, are around really knowing where to start and how to assess their own readiness within their organization or current structure. So things asking questions like, if we start small, what will or could be the impact or outcome? What domain do we start with? Really kind of finding and creating that opportunity can sometimes be a difficulty to get started. Next is usually concerns about funding, financial aspects of an organization, and then leading into that sustainability piece. the questions around if we start it, how or what will be our opportunity or ability to be able to continue to fund it. One example might be if we start to implement into our policy trauma-informed training for all of our staff. Is this something that we will have funding to continue for the long term? Another barrier expressed is often around current staffing capacity. And then rounding out the top hesitations is kind of based in hearing someone else in the community is already providing behavioral and mental health services. They're not wanting to step on toes or kind of create some of those turf issues or duplicate services. So while these barriers are real, they are also really workable. You can start small. You can coordinate efforts so that they involve more of that multidisciplinary team approach across sectors of your community. You have heard from Tom talk about this with Aaron and have heard the different examples that he's given about the difference this has actually made, not only to his staff, but to the clients of their health department and kind of the community at large. There can be collaborations within the community to enhance communication and create maybe either additional or different access to services by streamlining referrals or finding where the health department can begin to add in tools like screening questions that provide more insight on maybe what a client is needing at that moment in time or could benefit from in the long term. It's really more about looking at those barriers, but also coming from a lens of how can we help our clients be seen and heard at all levels of all of the systems that they're accessing for help. Tom does bring a perfect example of overcoming hesitations and how to hurdle over what barriers seem to be present at the moment. So let's take a listen.
Well, thinking about uh, the efforts that you've been putting in over the years, what are some of the biggest barriers that you've encountered in this work? And I'm thinking about this in terms of advice for other health departments that are ready to jump in and start doing some of these things.
I think there's going to be naysayers no matter what you do. And the biggest obstacle that I faced was my own doubt that we would be successful. I didn't think we would have the sway, that we would convince people. I thought about some of the initiatives that we've got going on in our local school districts, and I'm like, they're not going to believe me. I'm going to come in and I'm going to talk to a board of education, and they're not going to buy in. And the superintendents just slayed me. you know, I figured I had to really sell it hard to them what we wanted to get accomplished. In law enforcement, I thought, man, they're not going to. These people have rushed to this, and one of the superintendents looked at me and said, "Tom," he says, "there's no one of us in this room that wants to be the guy that stands up and says we're against suicide prevention." You know, and it didn't even dawn on me, but the magnitude of the issue creates an almost automatic acceptance of it. And so then of course comes well, how do we fund this? That's the next barrier. And how do we find dollars to make things happen? And in that realm, we had to do what we've always done. And I think sometimes what those of us in administration and public health do the best, we had to start looking for grant opportunities and writing for grants. And it didn't matter how big or how small it was. A couple $1,000s here, $10,000 there, whatever it is. We had the plan. Once we had that framework there, we knew exactly what we were writing for. And that made it so much easier to where we could fill the stuff in and we could describe it, and we would have conversations with funding partners, and they would listen to us and they'd say, yeah, I think this is what we want to be involved in. How much did you need? 10? How about we make it 15? And I'm like, what? Okay, great. That is what that well-developed plan and that little bit of effort already that we've put into it have brought forth. They say that, your preparation and your education, all of these things coalesce together to make you lucky at some point in time. That's exactly what it was. Oh, you're lucky that you got this. No, we were just prepared. This where we were at. We were passionate about it. We could show people what we were doing and how we were trying to do it. We don't know if it's going to be ultimately successful down the road, but we know that if we did nothing, it was going to be tragic. And so by getting as many people involved and getting the community involved, and then asking the school districts, can you put a few bucks into the pot, and we'll throw some in, and you get a collaborative set up like that, it becomes not just available to start, but I think what it is going to create over time now is a sustainable model, because it will be that important that we'll continue to see it funded. And even within the state of Kansas, it has become um, a top item list. So if you're sitting there thinking, oh, there's not going to be money, or we're not going to get anywhere, you've got to let that go. You've got to put that out of your head. You've got to start. Pick up this framework, look at it. Where are you best situated in this realm? Do the things that you can do the best. Tweak those little things and watch the results, and track it. That's the other thing. You've got to track this stuff to some extent to show, who you're talking to and what you're doing.
Jumping into some recommendations, things that we've learned from Tom so far include pick up this framework. Take a look at it. Or if there's another framework that you have that you want to maybe combine efforts, just start somewhere, find some place to start, and approach it without fear and hesitation. Feel like you're going to be successful from the start. Ask yourself, where are we best suited to start as an organization? Asking those internal questions, asking those external questions of, at our current state of practice, what can we add in at this time? And just do the things that you can do the best at. Create and maintain those partnerships. There's something so incredibly valuable about cross-sector collaborations or multidisciplinary team collaborations. People begin to come out of working in those silos and really start working from a team perspective. It doesn't always mean that you have to share all of the information or details about clients, but sometimes it's just knowing what one person is doing or what one organization is doing and what they bring to the holistic approach to behavioral health and mental health services and access for clients in your community can really, really, truly make a difference. And I know one of the quotes that Tom said earlier was, if we do nothing, we know that it's going to be tragic.
Aaron, this type of an interaction is really pretty neat. I feel humbled that, I was able to start something just with a question. And I think that people should learn from that experience. Don't think that you're not worthy to ask the question or to bring the topic up. That would have been, I could have sat there and been too timid or shy, but you know me, I'm not that way, and wouldn't have asked. But that I think was probably the greatest single thing I've done in my public health career, was ask that question. Does anybody have any answers? Because we don't know. I mean, I just want to thank you personally for taking it back to them and saying, hey, we got to do something, and doing the research, and creating this template to begin with, and then letting us sit there and hash it out and bang it around. One of the things I do know what we talked about, and I want to tell this to every administrator that's out there. We looked at it from the framework of, how would I feel when I saw this? Oh, it's just another toolbox. It's just another toolkit. And I don't have time for this. We did not want it to be that. We wanted it to be an absolute framework that you could adapt to fit your organization, to fit your county, to fit your clientele, so that it could be for Cowley County or Cloud County or Shawnee County or Seward County. It does not matter. Take this, see what you've got, work from your strengths, and then ask for help with the weaknesses, and it will happen. It really is. You have to want it. And I'm thrilled that the partnership from WSU again will help put this kind of up uh, in the forefront, so people can see it, look at it, and have an opportunity to pick it up and make it their own. That's my challenge to everybody out there that's in my spot. If I can do it, you can do it too. So pick it up and let's go. Let's see
Well,
what happens.
I'll add to that, Tom. I think you've inspired a handful of folks, including my staff, when that exact thing comes up, and your response is always, "Why not us? Why not
Yeah,
now?"
exactly. What are we waiting for?
We are so thankful to Tom for his transparency in this process and also his tremendous effort and the things that he's continuing to do with all of the partners and community members that he's engaged so far. We also have other health departments in Kansas. If you take a look at the framework and the guidance document that we have for you, to utilize, you can see that we have learned so much from them as well. And they lent to this framework by providing input and practical examples of the work that they're doing to make a difference for their staff, their clients, and their community members. Don't wait. The time is right now. We want to thank you for taking the time to listen in today to learn more about the efforts in Kansas to positively impact behavioral and mental health and overall community well-being. We'll leave you with this last message from Tom.
We're excited about the progress we've made and what's going on here, and we hope that we can continue to demonstrate how it will work. And if people want to call and chat with us and see how we're doing it, or just come by and visit, we'll do it. We'll co-op with you guys and help put on workshops, whatever it takes to make this more and more of a reality. I think is what we need to do, and I hope everybody will see where we're coming from. This isn't made up, and we're certainly not,
Hmm.
we're not trying to sell, a bag of goods. I mean, this is a good progression, a good point to be at, based upon where I am today on June 1st, 2023, and where I was in June 1st, 2019. That's not that far away. That's that, and a lot has happened in that time period. So I'm thrilled with it, and I hope everybody else can, share in that excitement and that passion that we've got. So
Yeah.
that's it. Yeah.
Well, I really want to thank you, Tom. I mean, I think your passion, your willingness to share and kind of help guide this process along, well, to start a lot of this process,
Yeah.
but then to guide it along to where it is. I mean, I don't think we can ever thank you enough for
Uh,
everything that you've done, and thank you so much for sharing, because I know we
yeah.
really want to kind of get things moving and get more conversations going so that we can help others.
Please feel free to reach out to any of us here. We'd love to have a conversation about this project or to be able to answer any questions that you may have. Thank you.